Dr. Felicity. I'm one of the clinicians here at SkinViva. Today I'm going to talk to you about some of the risks, side effects and possible complications of dermal filler treatment. Dermal filler treatment is one of our most popular treatments that we do, like for lips and things like that. So it's really important that you do know that there are some potential side effects and risks, just so that you make a really good decision and that you're happy and comfortable with the decision that you're making. So first of all, it can be a little bit uncomfortable having filler. It's a slightly thicker needle. If you've already maybe had Botox, that's quite a thin, tiny needle, but your filler, it's a little bit of a thicker needle. So before we start treating you, we'll put a little bit of numbing cream on just to make you as comfortable as possible. We are using a needle, and because of that, wherever we put a needle against the skin, it can leave a red mark or a bump or a bruise. Now that's particularly more so around the lip and mouth area. There are lots of tiny little blood vessels around there, which is why you can bruise a little bit more. If you bruise after your filler treatment, it can take quite a few days for that to settle. So you might want to do something like take some arnica tablets, or even buy just a little bit of arnica cream. You can just get that from your pharmacist. Really easy and simple, and it just helps break the bruise down quicker for you. We wipe the area down before we treat you as well, just to minimise the risk of any infection, because again, we're using this needle, and because it pierces through the skin, it's really important that we give you a good wipe down before treatment, and if necessary during treatment as well. We're more than happy to see you. If you want to come with full makeup on, that's absolutely fine. Come to your clinic however you wish to. If you have no makeup on, we will still wipe you down, so it really makes no odds to us. However you're most comfortable coming for your appointment, that's what you should do. After you've had your treatment, you might swell up a little bit, again particularly around the lips. Depending on the type of filler you've used, if you use our Ultra range, which is your standard range of filler, you might notice more swelling because it does attract more water to the area. So please don't be alarmed by that. It can be quite significant over the first couple of days, and that is to be expected. Things that you can do at home to minimise that swelling is get a cool pack after your treatment. Make sure you wrap it in a towel or maybe a sock or something like that, and then just hold it gently like this. Not pressing too hard, we don't want you to ruin that lovely shape that we've created, but if you can just hold it gently against your lip like that, it will really help bring some of that initial swelling right down for you, just so you're feeling comfortable after your treatment. Something that we are concerned about with filler is something called necrosis. Now that is basically if a little bit of filler were to get into one of the blood vessels that supplies the skin on your face, it would block the blood getting through. If your skin isn't getting any blood, over time, if left uncorrected, that patch of skin could potentially die off. Now, I'm not telling you this because I'm trying to put you off having treatment or frighten you or anything like that. I'm telling you because it's really important you know what to do if that happens. If when we're doing treatment we've got any concern about the blood supply to your skin, we would use the reversal agent for the filler, which we always have at clinic. If we are quite happy during treatment, we would always say to you, afterwards, if you notice that your skin is changing colour in one patch, it might be going a little bit of a dusky colour, and it's painful, please get in touch with us, don't leave it. It's usually within the first 12 to 24 hours after your treatment, so it's quite an early onset complication, but please contact us. We will see you if we're worried, and we will reverse it for you if we're concerned at all. That's the most serious complication of a filler, but it is rare. It's less than 1 in 20,000, and to minimise your risk further, again, before each and every injection we aspirate. So before I push filler into you, I pull back on the needle and just check that I'm not seeing any blood in my syringe. If I am, that would suggest I'm in a blood vessel, and it would be an indication to come out and find a new position to keep you as safe as possible. Necrosis, like I said, is something that would happen fairly early onset. If after 24 hours everything's been fine, it's not something you need to be concerned about. Very occasionally, further down the line, and I'm talking maybe months down the line, we have had 1 or 2 clients come back and have noticed a little lump. It's not usually hard, but they've suddenly noticed that there's a little bump where they've had some treatment done. Again, always get in contact with us so that we can have a look at it, and if necessary, we can break that down for you, again using the reversal agent. You will get a text from our customer services team just to check everything is all right, but do always feel free to contact us if you have any concerns yourself. We would much rather hear from you and deal with it if it needs to be dealt with. But again, we're all trainers here, we all do a lot of treatment all the time, and so you should be safe with us, and we are key in making sure that you are safe. We want to make sure that you are happy and comfortable with your treatment decisions, which is why we will go through all of this with you before you have your treatment done again. If you've got any further questions, do feel free to ask them at your consultation as well. Let us put your mind at rest if there's any little niggling issues that you're concerned about. But you are safe to have the treatment done. Any complications are correctable, they're reversible, and actually the risk of those complications occurring are very, very small.